Great. So I think we'll make a start then. It's fantastic to welcome Dr. Mary Warrell from the Oxford Vaccine Group to come and speak today about rabies in Myanmar. Mary's worked on rabies for more than 40 years and has many years experience of working in Thailand, so knows the region very well. And it's really great that we've got Mary to speak to us today. There's lots of opportunities for questions. I think Mary's going to deliver a presentation, and then after that, lots of opportunities for questions, either in Burmese, which San can translate, or in English. It's entirely up to you. And I'll keep an eye on the Facebook chat as well to see if there are any questions there. Thanks very much, everyone. It's really nice to have everybody here. And Mary, thank you so much for giving up your time to come and speak to us. Thank you very much.
Well, thank you very much for asking me to talk about rabies. I'd like to show you how nurses can have the most important role in managing patients and preventing this terrible disease. This patient was bitten by a dog a few weeks previously. He now has rabies encephalitis. He's very thirsty. He tries to drink, but finds he can't swallow. He has hydrophobia. And this encephalitis begins with vague prodromal symptoms of fever, mood change, and agitation. The only specific symptom is paresthesia, or abnormal feeling at the site of the bite. And this might be itching or pain or numbness. It rapidly progresses to prostration, and they have sweating and hypersalivation, but they cannot swallow the saliva. There are two clinical forms of rabies: furious rabies and paralytic or dumb rabies. And furious rabies is characterized by hydrophobic spasms, which are provoked by trying to drink or a draught of air, aerophobia. And they are reflex, forceful, jerky spasms of the muscles of inspiration. It's just like when you're about to sneeze, but it's associated with an inexplicable terror. And it progresses maybe to a convulsion, perhaps cardiac or respiratory arrest, and pneumothorax and seizures. And these patients will only survive for a week or maybe two. Dumb rabies or paralytic rabies is quite different. It's a slow ascending paralysis with fever again, and sweating, salivation, sphincter dysfunction, and the paralysis ascends, eventually involving the muscles of respiration, and the patient dies. But maybe they'll live for 3 or 4 weeks without any special treatment. Once the symptoms of rabies encephalitis have appeared in people who've been bitten by dogs, it is always fatal, 100% mortality. No patient has recovered as a result of intensive care, even if they've had some vaccine. Intensive care is useless. But it's important to exclude other diagnoses, other causes of encephalitis. Once it is decided the patient has rabies encephalitis, palliation is the best management, but with compassionate care. And this does not mean putting the patient in the side room and shutting the door. It must be active. To try and prevent the onset of hydrophobic spasms, it should be a calm, quiet, dimly lit, draft-free single room. And the patient may become very anxious and appear aggressive. They might need to be restrained. And you can tie them to the bed, but very loosely, so they can move around, but they can't get off the bed. They should be monitored frequently, and there is no case known of a carer being infected by a rabies encephalitis patient. This is very surprising because many people and patients are nursed at home. But there is virus in the saliva, and so the staff should have gloves and masks and gowns. And they should be offered pre-exposure vaccination, which will give them, which will reassure them and give them confidence to nurse without fear. The patients are very thirsty. They can't drink, so IV fluids might be possible, but if not, then they can suck a wet sponge or a swab for some relief. Fever can be treated with antipyretic drugs, and sedatives and tranquilizers can be used to relieve anxiety and fear and try and prevent seizures. The hypersecretion might become distressing and can be treated with drugs. Pain is not usually a feature, but it can be managed with drugs too. The infection usually begins with virus in the saliva of a rabid animal being inoculated under the skin and entering a nerve ending. The virus then ascends slowly up inside a nerve to the spinal cord during the long incubation period, which is usually 1 to 3 months. Once the virus is ascending into the brain, the onset of symptoms begin. And the virus travels down nerves to infect salivary glands and many other tissues in the body. Now, the diagnosis of rabies cannot be made during life in Myanmar. There are tests available which are difficult to do, but they're not available in Myanmar and in many other places. But post-mortem, a brain sample tested at the veterinary laboratory can confirm the infection. Rabies virus is enzootic in dogs in Myanmar. The virus is passed between unvaccinated dogs. It is there all the time. And it is not just at one time of year or in one season. There's always a risk. And the dogs might bite cats and other domestic mammals, but not birds. Chickens don't get rabies. They might bite monkeys too, and monkey bites are common, especially in tourists. They're a low but significant risk. Bats and other wild animals might also have rabies, and they have maybe a different strain. Biting animals are not usually tested for rabies. They're usually run away or it's difficult. So to determine the risk of rabies in a patient, you ask about the behavior of the biting animal. Was it behaving normally? If a tourist is trying to feed a monkey and gets bitten on the finger, that's pretty normal monkey behavior. But if it's an unprovoked attack, the monkey or the dog is running around just biting anything in sight, that is abnormal. Wild animals don't usually approach humans, and especially bats. So any contact with a bat is a high risk. Some dogs appear wild and furious, biting on iron bars, but some have a paralytic disease and can't stand up and are drooling saliva. The number of deaths from human deaths from rabies was reported to be 104 a year, but that was 7 years ago. And in the same year, 62 patients died of malaria. So now rabies deaths are higher level than malaria deaths. But these are only cases of reported which have patients who presented to medical care, to a hospital or clinic. But many patients die at home. They don't bother to come to hospital. They know there's no treatment. The encephalitis is diagnosed clinically because there's no test available. And dumb rabies is often misdiagnosed as other paralytic diseases like Guillain-Barré disease. Children might not have reported that they were bitten by a dog, so nobody even thinks of rabies when they have an encephalitis. And 40% of all human rabies is in children under the age of 15. And rabies is not a notifiable disease in Myanmar. So the result is we have no idea how many people are dying of rabies in Myanmar. Most people who are bitten by a dog try and find some vaccine treatment and maybe immune globulin. And this treatment works very well if it is given promptly and accurate and with a full course. But the treatment is often delayed and the treatment inadequate, and it's unreliable. Deaths might occur. Anyone who's had pre-exposure immunization, then has a dog bite, has a booster post-exposure short vaccine course, no deaths have ever been reported. This is 100% efficacy. This is good news. No other vaccine is so effective. So how do you manage this boy who was bitten on the ear by a dog in Myanmar? Well, this one actually was India. After a dog bite, you wash the wound, go to the clinic for assessment. If there's a risk of rabies, have the vaccine and maybe immune globulin. And wound care is very important. Wash and flush with lots of soap and water preferably under a running tap for a long time, about 10 minutes. Soap kills rabies virus, and that's very unusual. Soap doesn't kill many viruses. If possible, you then give Povidone iodine antiseptic, which is very effective, or alcohol ethanol, but that's very painful in the wound. Benzalkonium chloride, that's cetramide or Savlon concentrated, is good, but it's inactivated by the soap. So you've got to wash the soap out of the wound very well. Avoid or delay suturing the wound. It might inoculate virus deeper into the tissues. Don't forget tetanus prophylaxis. If there's a risk of rabies, give vaccine immediately. And home remedies, salt and chilies, oil, anything else should not be used. This washing should be done at home. It is a public health message. Everybody should know about this for any animal bite. To decide on whether or not vaccine is needed, these are the categories of risk of exposure. Touching or feeding animals or a lick on intact skin is no risk of rabies. It's the WHO category 1 there is no risk if the history is reliable. Minor scratches or abrasions without bleeding are low risk, and that WHO calls it category 2, and vaccine should be given. But bites through the skin or scratches or licks on broken skin and contamination, saliva contact of the animal on mucous membranes, like the mouth, the lips, the nose, and exposure to bats are all high risk, category 3. Vaccine should be given, and if possible, if it's available, rabies immune globulin. But the most severe risk is from deep and multiple bites, and bites on the head and neck and hands. This is because these are very sensitive areas, and there's a lot of nerve endings in the skin, and the virus can enter more easily. These should be treated as an emergency, and the vaccine and immune globulin should be given soon. And if there's a shortage of immune globulin, it can be reserved for these very severely exposed patients. Now, the vaccines that might be available to you are a purified Virocell vaccine, ViroRab from France, Spida from China, IndiRab from India, purified Chikungunya cell vaccine from maybe Europe, maybe America. I'm not sure where you get it from. And the vaccine regimens recommended in Myanmar, the intramuscular regimen, Zagreb 211 regimen, 2 whole vials of vaccine are given on the first day, 1 intramuscularly in each deltoid, 1 injection on day 7, 1 on day 21. Your regulations also give a 5-dose Essen regimen, 1 intramuscular dose on 0, 3, 7, 14 and days 28. This uses more vaccine. There's no great advantage. I would stick to the Zagreb regimen if I were you. It is more economical to give small doses of vaccine into the skin using the Thai Red Cross intradermal regimen. And the intradermal dose is 0.1 mil per intradermal site. And 2 sites are, 2 of these injections are given over the deltoids on 0, 3, 7 and 28. And that means sharing a vial of vaccine. You use less than 1 vial for 1 patient on 1 day. And this must be done using strict aseptic precautions, a new syringe and needle for every patient. But it's only economical if several patients are coming each day. An intradermal injection is you draw up the vaccine into a Mantoux or insulin syringe with a fine needle, inject horizontally into the skin, and you raise a small bump like this, and the surface looks like the skin of an orange. The intradermal regimen is represented like this: 2 intradermal injections on day 0, 3, 7 and 28. And the dose is 0.1 mil per site for any vaccine, even though the vials are some vaccines have 0.5 mil in a vial and some have 1 mil. Now, this regimen uses less vaccine and is economical if in a busy clinic where at least 2 or 3 new patients are attending each day, but it has never been economical or practical to use it in rural areas or small hospital clinics. And vaccine should never be wasted. If at the end of the day, the vial there's some left in the vial in the fridge, it should be discarded. It's not safe to keep it, but it can be used as intradermal injections as pre-exposure vaccination for the family of the patient or for anyone else around, staff, anyone who is willing to accept it. I'll come back to that. Rabies immune globulin is ready-made rabies antibody. It is injected into the wound to neutralize the virus immediately, because the vaccine takes about a week to induce the patient's own anti-rabies antibody. The dose is 40 international units of equine rabies immune globulin. It's infiltrated into and around the wound. Try and get the whole dose into and around the wound. Any remainder can be injected intramuscularly. It's vital, as I said, for these heavily exposed patients bitten on the head, neck, and hands. It's not available in many countries, and I suspect you don't have much, if any, in Myanmar. You can tell me about that afterwards. Anyone who's had a full course of rabies vaccine, whether it was pre-exposure or post-exposure, is then bitten by a dog, only needs a short course of vaccine. It can be intramuscular, 1 dose on day 0 and 1 dose on day 3, or the same regimen, 0.1 mil intradermally. But for many years, the WHO has recommended another regimen, which is 4-site intradermal single-day treatment. This means using a whole vial of vaccine and giving it intradermally at 4 sites on 1 day into the deltoids and the thighs or the suprascapular, which is on the back just at the top of the shoulder blade. Some vials of vaccine are 0.5 ml in a vial, and then the intradermal injection is about 0.1 ml per site. If the vial is 1 ml for an intramuscular dose, the site needs 0.2 mils in 4 sites. If 0.2 mils is difficult to inject at intradermally at 1 site, and if you do a really good ID injection, it is very often difficult. You just withdraw the needle and give another injection beside it. So you've got 2 little blebs. This is extremely good treatment. It induces antibody most quickly, and this is the best booster regimen, and I recommend it. You can use it anywhere, even in the countryside, a rural area, a single patient, because you're not wasting vaccine, you're using a whole vial. Pre-exposure vaccination is really good thing. It is recommended for people who are at risk of infection, laboratory workers, people who handle animals, veterinarians, dog catchers, wildlife workers, zoo staff, hospital staff who might be likely to care for rabies patients. I told you the risk is very low, but it gives the staff confidence. and residents of dog rabies endemic areas, that is the whole of Myanmar. The pre-exposure vaccine course is 3 doses, can be intramuscularly or intradermally. 1 dose on day 0, 1 on day 7, and 1 on after 3 or 4 weeks. But the timing does not matter. If there's weeks or months between the doses, it doesn't matter. The important thing is to have 3 doses. Keep a record of the immunization, and once someone has had 3 doses, if they're bitten by a dog, then they only have to have the booster vaccine course. They will never need immune globulin. And this is for life. You only ever need 1 course for life. It's an insurance policy for life against rabies. It's very good news. If you can afford it, you could buy a vial of vaccine and have intradermal injections for the whole family. Share the vial on 1 day and everybody gets 0.1 mil. And it's a very good way of spending money if the vaccine is available. Is this child at risk of rabies? Well, if the dog is regularly vaccinated, the answer is no. But street dogs are a high risk of rabies. You don't know if they're vaccinated and you're not sure if they're going to suddenly run at you. You know very well. It's difficult to avoid the dogs, but that is the thing to do to avoid rabies. Avoid mammals that might transmit rabies, monkeys or any mammal behaving abnormally. Teach children to keep away from dogs and report any injury. Anyone with an animal wound, thoroughly wash with soap and water and tell everybody else that. Vaccinate dogs and cats and give pre-exposure vaccination to your family if you possibly can. But the best way to prevent human rabies deaths is to vaccinate dogs. This vaccinator has the complete kit in his trolley. He has dog biscuits to attract the dog. He has a net to catch the dog. He has the vaccine in this cold box to inject, and a spray gun of dye to mark the dog afterwards so they know which ones have been vaccinated. And mass dog vaccination is very effective. Here are data from Sri Lanka. Over the years, the number of dogs vaccinated increased, and at the same time, the number of human deaths from rabies decreased. So that is definitely the best thing to do eventually. So to summarize, wash all animal bite wounds immediately and thoroughly, encourage dog rabies vaccination, encourage pre-exposure vaccination for anyone who can afford it if the vaccine's available, and use active palliative care for rabies patients. Well, thank you very much indeed. I would be very happy to try and answer your questions and to hear about whether you have vaccine available or not and immune globulin. What are your views of rabies?
Thank you very much. This is Sun. I'm going to be translate it for you. There are a few questions on a Q&A. I'm going to ask the audience about your questions first in Burmese. Is that all right with you?
Yes.
And Siamaya Pamele Soro, oh, Siara Siamaruma, the Quayu Nepatabio, oh, Sa, Dwejong Shibadala, Quayu Gagwasiri Yabatala, Quayu say Yalushin, immunoglobulin or vaccines got a Kusalon Yabala, Siamaya Mibarishin. Oh, Ale, Pamalo web to the English web to the type lopio chat box mapilo Yabare. Marcus, is chat box okay? Because I didn't see anybody typing on the chat.
I can see some of the questions. I can answer them that have come up in the chat. Shall I do that?
Thank you very much. Yes, please.
Okay. The first one, how much povidone iodine is needed for wound care? You just flood the wound with it, and there isn't a set volume or anything. You just want to expose the tissues that are wounded to the iodine mixture. Actually, rabies. Oh, you're saying that it is under national surveillance. Well, I didn't know that. I hope in future you'll get some more reliable data then. Tetanus prophylaxis is according to your standard regulations. They have a course, I hope, very, when they're infants and then have a booster. Is it every 10 years? I'm not sure what your regulations are. But if in doubt, you give a tetanus toxoid booster. Wait a minute. Can health professionals who treat rabies patients also do vaccine for themselves? Yes, of course. As long as if there's vaccine available, then you can treat each other, as long as you do it in a careful, aseptic way, and you record all the injections that you give. And the person must have a record, and you should have a record for the ward or the hospital if they're asking about it. They're jumping around a little. What are the, is it the difference between
I think it is the difference. Yes.
Oh, yes, in terms of effectiveness. Well, it depends how good you are at doing intradermal injections. If they're done very well, the intradermal is good, but it hasn't been used so widely without immune globulin. In places, in big clinics where it is used in other countries, they have immune globulin as well. I have views about this, and I think that there's a better post-exposure treatment, which is giving that 4-dose. I told you that the booster regimen, you could have 1-day treatment, a 4-dose, a whole vial intradermally. And the regimen that is also recommended by WHO is to start with that dose, give a whole dose intradermally, and that is very safe. And then you give half a vial on day 7. If you want, I can send you, you can have the link to a very short paper about that to explain it. But I don't know how strict your regulations are about using what is recommended in Burma. So I didn't dare to present it today. If you want me to send the paper, you can tell, and I will do it later. How many people can be vaccinated per 1 vial? For the Thai Red Cross post-exposure regimen, it depends how big the vial is. If it's a 1 ml vaccine, then 3 or 4 people can be vaccinated. If it's a half ml vaccine, then only 2 people can be vaccinated on 1 day. Why is the needle horizontally, not perpendicular to the skin? If you give it perpendicularly, it goes right through the skin. And so you want to keep it in the very surface layers, just under the epidermis. If you try and find a diagram of the skin, I could have showed you one, to be in the middle of the skin layers, very superficial, very close to the top. And then it is slowly absorbed, and that is the good thing. If you inject it below the skin, it disappears quickly into the tissues and isn't so effective. What do you mean seroconversion? I mean that the antibody has been produced and is at a level which is recognized as being sufficient to prevent infection. It's a half an international unit per mil. It just means that the vaccine has been effective and there is enough antibody there to prevent infection. What are the features of dogs who have rabies? Well, I said that it can be various. Some of them just get, they start sort of looking ill, and some of them start behaving unusually, biting inanimate objects, you know, wood, bits of wood, or some of them eat bits of wood or bits of stone or something. They might just run about just biting everything in sight, but they also might have the paralytic disease, as I showed you, and just still try and eat things, and the owner might think they've got something stuck in their throat, and so they try to put their hand down to take it out, and of course that's pretty high risk for rabies. So it can be very varied, but any dog who has really unusual behavior, you stand back and keep it confined if it's your pet. The dog vaccination, it depends on the vaccine, how long the protection lasts for. The people who give you the vaccine will tell you it might be every 2 years, but you have to ask them because it's always changing, and I don't know what vaccine you have there. ERO, what's ERO? Please donate vaccine to ERO. I don't know what that is, but getting vaccine is a big problem all over the world, and it's your government or the health ministry has to buy it, doing a deal internationally with the company, and it's a big problem to obtain it, and that's why I want to know if you can have it, if you can get hold of it. the
next,
sorry.
sorry, the next one is written in Burmese saying that there is no immunoglobulin available in Burma.
Well, that's what I expected, I'm afraid. And somebody, I missed one. Someone said, is the dose of vaccine the same for adults and children? And the answer is yes, it's always the same. And there's no rabies vaccine in villages. I'm afraid I expected that. That's a big problem. And that's why I said, if you've only got one vial to treat a patient after a dog bite, give the whole lot intradermally in one go, wherever you are. That is what I recommend. Because in some studies, that is enough to produce enough antibody for seroconversion to get above the level. And you don't waste vaccine. And if some of the intradermal injections go wrong, then it's not serious because you're giving a lot of vaccine. After wound care, can I cover the wound? Yes, you can cover it, certainly. And you don't want to suture it, but you can draw the edges together of a wound, and then maybe if it needs suturing a later date. But yes, just sensibly so it's comfortable. And it's very good to, you must cover it. I mean, you should. Can virus stay in the body after the symptoms disappear? The symptoms don't, once encephalitis has begun, and there are symptoms, the patient is going to die. The virus, after a bite, is inoculated. You want to stop it getting into the nervous system. Once it's in the nervous system, it's protected from antibody attack. So I don't really understand that question. Use tap water. Why use tap water? Sorry?
Dr. Warrell, can I answer this in Burmese for this person?
Yes, please.
This, yeah. And Wale virus ka khana ko re ma shi la de like yoga lakhana ri pyauk twa de chain ma lo me tha de tayauk ka le era ba le so ro yoga ya bi so ai lu ya tei twa de so shin de lu tayauk ma ma shi yu era ko pyo chin da ta lai san be phit phit lu be phit phit di khwe yu yoga ka lakhana pya bi so lo shin a long ma tei de 100 %နှုန်းteiနှုန်းရှိတယ်အဲဒါကြောင့်မလို့ဒီဟာကအဲ့ဒါရှင်းမယ်လို့ယူဆပါတယ်ရှင်ဟုတ် Yes, over to you, Mary.
Okay.
Thank you.
Why use tap water instead of saline? Because saline is expensive, and tap water, you just have the running tap and do it under. You need a lot of water. And you really, it isn't just a rinsing out, a lot of soap, a lot of water for at least 5 or 10 minutes. So no, saline is not necessary, and it's not possible. How can you confirm that the dog that bites a child has rabies? Now you can, if you've got veterinarians who can help you, and if there is a laboratory that will accept brain samples, or maybe a whole dog's head. Some people in Thailand, they used to bring the dog's head to the laboratory for testing, and they can give a result the same day. It's a quick test and it's very good, but how it works, the practicalities in Myanmar, I'm not sure. Ask about it, find out. If I get bitten again after one vaccination, do I need another? If that means if you've had one course of vaccine, every time you have a dog bite, you need a dose of vaccine. What are the first symptoms if the patient has rabies? Well, they, I think I said in about the first or second slide, they have very vague, the initial things are very vague. They might be anxious, not well, have a fever. Fever is common, and vague symptoms of encephalitis. But soon they tend to develop something, difficulty in swallowing, or if they're bitten on the arm might become tingly, or they have slight pains or aches in the arm, or it becomes very itchy. They're scratching. Sometimes they scratch the whole arm if they're bitten on the arm. So it is very vague, and that is why the diagnosis can be missed so easily. You just have to think of rabies. Cat bite, yes, cats can definitely cause rabies if they've been bitten by a dog or contact with a dog, and you would never know that. And cats can be very aggressive when they have rabies. They tend to bite very, very quickly, and a rabid cat is a frantic thing, difficult to control. Any more questions?
Yes, as a couple, and Dr. One is, does dogs need to vaccinate yearly for rabies?
Well, I said I don't know what vaccine you have, but ask go and have your dog vaccinated and ask them how long it lasts. It may be 2 years. It should be 2 years at least, but it depends on the vaccine you have, and the people who are using the vaccine, who will give it to you, will tell you.
Thank you. I think that another question is more or less the same. Does rabies vaccine need annually for high-risk populations? I think this is more or less the same.
People, once you've had one course of rabies vaccine, if it's pre-exposure or even post-exposure, you don't need to have a booster just to keep the antibody. You only have to have vaccine again if you're bitten. After a pre-exposure course, you never need boosters. But everyone must know, if they're bitten by an animal, they try and get vaccine.
Thank you so very much. There is no more questions that I can see. I'm going to ask in Burmese. Ba mya me sia shi ba de le shin. Hwa phit lo shin ba ma lo yi pi ro le type lo lo ya pare. Di sia ma yi aro usa di khwe yoga ne pat tat pi ro ma kaba paw ma namal chi ye tu a ayan hwa phit de atu pyu sia ma yi phit pare. Ero tcha ba me kun ne ne shi ba de le shin. Ho na pi khu na tu phit khe de me kun ne de ma ma shin na shi yin te cha na ma le lai lo shin le thap pi me lo ya pare. Chama pit ma pa ma lo pyan pi shin pya ba me shin. Me kun ne ne me sia shi ba de le shin. Okay, the question is how safe is the vaccine? That vaccine cause infection?
How safe is, the vaccines cannot cause infection. They're killed virus. They're very safe to use from that point of view. And the side effects of the vaccine are just maybe just like any other vaccine, like flu vaccine, like anything, maybe a mild fever or might be a bit painful. And intradermal vaccination might cause a bit of itching afterwards, might be irritating, but there's nothing serious. And I'm sorry you cannot see me, but we have
It's okay.
Marcus has not, we've not managed to make communication. I'm sorry, my video is not being
No, I've struggled with this a bit. Sorry about that.
oh, wait,
It's all right. I'm going to.
It's happened. Can you see that? Can you see?
Not
Oh.
yet. No, I'm still struggling with that. I'm sorry about that.
Okay. Because well, that's all right. I can do it. I can see myself now, but that's hopeless. Okay, well,
okay. I think I can answer the questions which is written in which was asked in Burmese. Exactly. Oh, ဒီခွေးရောဂါဖြစ်ပြီးတော့ဘာဆင်းမလုပ်လို့မပြောက်ပါဘူးဆရာမကြီး lecture မှာလည်းပြောသွားပါတယ်တရားရာခိုင်နှုန်းသိနှုန်းရှိပါတယ်အဲ့တော့ဒီမေးခွန်းနှစ်ခုစလုံးကိုဖြေပြီးသားဖြစ်သွားပါလိမ့်မယ်ခွေးယူပြန်ပြီးဆိုရင်လူတိုင်းသိပါတယ်ရှင်ခွေးယူရှိတဲ့လူရောလူရောခွေးရောပေါ့နော်ဟာ Okay, the other question is, what is the dosage regime for neonate rabies vaccine? I don't think newborn baby should be bitten by the rabies. I don't know.
You're quite right. I think once a child is walking, or and it might be near dogs or animals, then that is the time to give them pre-exposure, but not when they're a tiny baby. And also their immune system is not well developed when they're neonates. So wait until you take them out and they're toddling on the street or something, then it's time to do it. I immunized my children when they were, I don't know, about 6 months when they were in Bangkok.
ဆရာမကြီးကပြောတာပါလဲဆိုတော့လေသူတို့ဆက်စလှုပ်ရှားလာမှတွားသွားမှဖြစ်မှလမ်းဆရှောင်းမှပဲထိုးပေးတာ pre exposure ပေါ့နော်ခွေးရုံမကိုက်ခင်ထိုးပေးတာကောင်းပါတယ်တဲ့ဘာလဲဆိုတော့အမွေးပေါက်စာကလေးတွေကသူတို့ရဲ့ခန္ဓာကိုယ်မှာရှိတဲ့ကိုယ်ခံစွမ်းရည်တွေကလေဆေးပေးပေမဲ့လည်းထုတ်ချင်မှထုတ်နိုင်မယ်ပေါ့နော်သူကတော့ရိုးရမှာနေတော့သူ့သားသမီးတွေကို6လမှာစပြီးထိုးပါတယ်တဲ့The other question is, what is the longest incubation period do you encounter?
That's a good question. It's over a year. And you can tell this from imported cases, people who were lived in the Philippines or something and then went to live in America. Then they were bitten by an animal in the Philippines, and years later, up to I think 4 or 5 years later, but the patient became immunosuppressed. They were given steroid treatment and then developed rabies. Now this is very unusual, but the incubation periods over 1 year are well known, and patients on steroids maybe more like immunosuppressed patients maybe don't produce such good antibody. But in Myanmar you cannot tell, because if you have a dog bite and then someone develops rabies 2 or 3 years later, you cannot be certain that they haven't had another exposure to rabies that they didn't notice maybe a few weeks ago. So you can only tell that. But even if a patient has had a dog bite months ago, and they haven't had any vaccine, it's never too late to vaccinate. Give them a course of vaccine as if post-exposure.
Another question is immunoglobulin not recommended in the previously vaccinated patients with confirmed rabies dog bite?
Immunoglobulin, no. Once you've had a complete course of vaccine and you have a booster vaccination, the antibody will appear in very few days, certainly less than a week, and you do not need immunoglobulin, but you do need very good washing of the wound.
Next question is why there is different dosage regime for rabies vaccine? Which one is the best?
Well, in Myanmar, it depends how much vaccine you've got. The best regimen is the one that produces the most antibody in the shortest time. And so giving a large amount of antigen on the first day is good. I think that in Myanmar, the intramuscular regimen is the Zagreb regimen 211 is the best to use rather than the intradermal, because the intradermal is giving a very small amount of vaccine on the first day. And as I said, it's been used in places where immune globulin is available, in Bangkok and in the Philippines and in India. So if I were in Burma and I had to use one of your regimens, I would use Zagreb. But I said, I will, if you like, I will send you a paper about a cheaper, economical intradermal regimen. And if you're allowed to use it, then I would use it, and recommended by WHO.
Thank you. I think it will be nice if you can send the paper so that we can do the journal club, follow-up journal club. That will be good. The other question is, when you're pregnant and get bitten by the dog, can you get vaccinations?
Yes, there are no contraindications to rabies vaccine, and pregnant women are a bit immunosuppressed. They really need it. There is no reason at all to withhold rabies vaccine.
ဆရာမကြီးဖြစ်ပြီးတာကိုဝင်ဆောင်နေလို့ရှိရင်လည်းထိုးလို့ရပါတယ်တဲ့ဘယ်ဟိုစာသူတို့မှာမထိုးပြရဘူးဆိုတဲ့လူနာမရှိပါဘူးတဲ့ The other question, I'm not sure you can see that, can they vaccinate rabies who have COVID vaccine before a few days? So that I think what he wants to ask is
the vaccines won't interfere with each other. They're both killed vaccines. It's maybe better to wait. If it's post-exposure vaccine, you give it whatever the recent vaccinations, because it's so important to have the vaccine immediately after you've been bitten. And then if you're going to have COVID vaccine, well, maybe wait a week or 10 days, but it's not serious. It doesn't, I wouldn't worry.
Thank you. The other question is, if the patient have vaccines with one brand for day 0, can they vaccinate with another brand in another day? For example, due to a shortage of vaccine, or
no, that's fine.
Regime. Yeah.
That's fine, and it might be a good thing to do. It's like COVID vaccines. They find that mixing the vaccines it can have benefits. So it doesn't matter.
Okay, can they switch to another regime?
That's difficult. and you're probably going to use more vaccine. If you started on intradermal, then you need to have another dose on quickly on day 3. So I think better stick to the same one, but if you try and mix them, you're going to use more vaccine.
Thank you very much. I think everybody အားလုံးနားလည်ကြတယ်လို့ယူဆပါတယ်ရှင်။နောက်ထပ်ဘာများနေဆရာရှိပါသေးလဲ။ဆရာမကြီးကသူ့ရဲ့ဟိုဟာဖြစ်တဲ့ journal ကိုကျွန်မပို့ခိုင်းထားပါတယ်။ကျွန်မတို့ journal club လည်းလုပ်လို့ရအောင်လို့
If they have any questions afterwards, they can email me.
ပြီးတော့မှမေးခွန်းတွေပေါ်လာလို့ရှင်လဲဆရာမကြီးကို email လုပ်ပြီးမေးလို့ရပါတယ်တဲ့။ Okay. Thank you so very much. I haven't seen any questions, or are there any on the Facebook, Marcus?
No, nothing at the moment. That's great. Thank you ever so much. That's been a really great session, and I'm sure a real help. And if there are any questions that come up afterwards, we'll either forward them on to you, or people can find your email address as well.
Okay, thank you very much.
Thanks very much, everyone.
Have a good day.
Stay safe, everyone.
Thank you for coping. Okay, bye.
Thank you
Thanks,
so much.
bye.
That was very useful. Thank you. Bye.
Bye.